March is Multiple Sclerosis Awareness Month. Senior health correspondent Monica Robbins talked with a local doctor about the impact menopause may have on the disease.
Fatigue, mood swings, sleep problems, brain fog. Those symptoms could point to a lot of things, including both MS and menopause. So how do you know which is which? Well, joining me is Cleveland Clinic neurologist Dr. Elise Carlson, who is also a specialist in multiple sclerosis. These are conditions I never thought I would put in the same sentence. So what do women need to be aware of?
Yeah, so first of all, thank you for having me today and bringing awareness to this very important topic. In the United States, there are about 1 million people living with multiple sclerosis, and of those people, about 30% of them are women in the perimenopausal or menopausal phases of life. So this combination, menopause and MS, affects hundreds of thousands of women. And the symptoms have substantial overlap between the two. As you mentioned, things like thinking problems, mood disruptions, anxiety and depression, severe fatigue, body aches and pain, bladder problems, sexual dysfunction, all can stem from both of these conditions.
So if a woman comes to you and she's exhausted and she's not sleeping and she's having bladder problems and she sounds like every other woman I know, how do you know which is which?
It's a really good question, and I think that comes down to teamwork between a patient and a provider, right? The patient has to communicate their symptoms to their provider, and that can be done through symptom diaries to help us recognize patterns and really look at the whole spectrum of symptoms that someone's experiencing. And then a provider may do a series of tests that include possibly a neurological examination, blood work, or imaging studies to determine if multiple sclerosis is active and at play.
This is really scary then, because what I'm starting to think is, are there a lot of cases of MS that are not being diagnosed because women think they're just going through menopause?
That could be the case at some points, right? But most women are actually diagnosed in the earlier stages of life, averaging late 20s to early 30s. So the more common scenario that I encounter is women with multiple sclerosis are starting to have some of these symptoms or a combination of these symptoms, and they're not sure, is this because my MS is active or worsening, or is it because I'm entering menopause? The converse can be true, however, though, that patients are experiencing some of these neurological symptoms that they've never had before, and it's important to make sure that that's not due to an underlying neurological disorder like MS.
Is there a biological or hormonal connection to all of this?
There is. So what happens when a woman transitions into perimenopause and menopause is the sex hormones, estrogen and progesterone, begin to drop. And we know that there's a lot of interplay between these hormones and how the immune system functions. And because MS is an immune-mediated disease, we see some shifts in how that disease activity looks in a person.
Does menopause make MS worse?
It can, specifically because many women with menopause experience what we call vasomotor symptoms, which we term hot flashes, right? And when those hot flashes begin, it can make the nerve function decrease. So it can worsen the underlying pre-existing symptoms of multiple sclerosis.
So if a woman is dealing with all of this, what are the treatment options available, the management options available?
Right, so that's a really good question, right? Because the first branch point is, are these symptoms due to menopause or are they due to multiple sclerosis? If it's determined that they're due primarily to menopause, we can do a couple different things. We can do non-pharmacologic treatments, meaning things that don't rely on medicines. Those would include lifestyle modifications like healthy diet, exercise, sleep hygiene, and then other therapies like psychotherapies or cognitive behavioral therapies, and all of those things can really help women improve their quality of life. And then we can also reach for medical treatments as well, and those may include hormone replacement therapies in some patients if those are deemed appropriate. We know based on the studies that have been done to date that these appear to be safe and effective for women with multiple sclerosis. Those still should be assessed on an individual basis for safety. And then when hormone replacement therapy is not appropriate for someone, we can reach towards medications like SSRIs that can help minimize those symptoms.
Bottom line, what's your message to women?
My message to women is that with this substantial overlap, make sure to advocate for yourself, keep track of your symptoms so that your providers can help you identify any patterns, and be comfortable discussing these issues with your provider.
Dr. Carlson, great insight. Thank you so much.
Thank you again for having me.